everyone, it's me again. I'm Lena, and in this video I'm going to talk about my main video, which is on communication in medicine. Now this week, according to the 12-week plan that we planned for ourselves, we are going to talk about communication in medicine and healthcare, in which we're going to need to talk about the importance, the applications or examples, and the ways to improve communication skills and how to communicate effectively in healthcare with our patients in the future. So yeah, that's basically what is in my video. So let's get started on the first part, the examples of communication in healthcare. Now we all know what is communication. Communication skills is the ability to communicate with another person, like using nonverbal and verbal communication. So the examples of communication in healthcare and medicine is firstly the doctor-patient communication. This is arguably the most basic example that I can give you, because the doctor-patient communication is the communication in which I have to deal with every single day. So as a doctor, when I'm examining my patients' conditions, I need to explain the diagnosis, treatment plans in a way so that my patients will be able to understand my points clearly. And I will also need to provide clear and concise instructions about medications, their treatment plans, and dosages, again, so that they will be able to know and have a good idea of what they're needing to take into their body. And of course, they will have a say in what their treatment plan is. They need to work with the doctor. Communicate with other healthcare professionals. So communicating with other healthcare professionals on a certain kind of illness that is broad, that is severe, and include many other fields, many other career jobs in the healthcare and medicine field. Well, I will need to communicate with other healthcare professionals, for example, about neurocancer, about the cancer in the brain, about some treatment plans for the patient, and maybe I need to talk to the surgeon or the surgeon's assistant or someone that will help me with the treatment plans for my patient. The third example, and the last example that I will give you, is delivering the bad news. So every day as a doctor, in the future, I will need to deliver some bad news to the patients. For example, they're having this illness, or they're having a life-threatening disease, or giving the patient's family or the patient themselves some bad news. And to deliver bad news, I must have an appropriate tone, a private setting, and use clear, concise language, and also show a bit of empathy there too, lots of empathy. Those are the three examples of communication in healthcare and medicine. Next is the importance of communication in healthcare. Now, the communication in healthcare, some importances of it is patient satisfaction. So firstly, for the patient satisfaction, accurate info exchange will help with patient satisfaction. How? Well, if we have the accurate information exchange and the effective treatment plans, then the patient will be free and immune from that disease or infection, and then it will lead to patient satisfaction. And yeah, that is basically what I'm talking about. Next is reduced medical errors. Now, like I said before, with the accurate information exchange, it will lead to reduced medical errors. Since reduced medical errors, because when we have accurate information exchange with other healthcare professionals, they will note it down in their notes, and they will have clear, when we deliver a clear, concise, when we have clear, concise language in our time, there will be accurate information exchange, and therefore it will lead to reduced medical errors. Teamwork. Now, for this idea about teamwork, well, communication will help with building the bonds and relationship within the team. So we will have a better treatment plans, more effective treatment plans, and there will be no conflict within the team. Next is enhanced adherence to treatment. So I'm giving the patient some explanation for what they're having to for their treatment plans, and if they understand me, if I communicate with the patient effectively and efficiently, then they will be more likely to collaborate with me with the treatment plans. Next idea that I want to talk about is reduced work stress. When we're working in a team, let's say the medical team, when we're working in the team and everyone has a role to play, then the team leader will have to do all the tasks that the team has to do. So instead of one person taking all the responsibility, everyone takes the responsibility, and each task will be divided equally within the team. So there will be reduced work stress, and finally, improved decision making. So improved decision making, when we have effective communication, it will lead to improved decision making as well. So those are the importances of communication in healthcare. The third part are the ways to improve communication skills. Now, I have talked about the ways to improve my communication skills, but I'll cover it again. Be brief but specific. Get to the point. Generally talk about, just give a summarization and then go into the key points. So that is what I mean. Conflict resolution. And the next one is conflict resolution. Conflict resolution, let's say I'm working in a team and I am the team leader, just for example, and I need to be able to resolve the conflicts within the team. Thirdly, be mindful and kind. So in the communication, when I'm having the doctor-patient communication and interaction, I'll need to have empathy, and empathy plays a key role in having effective communication. Reading books and articles is another way to help with improving my communication, because when I read books and articles, I will have a better knowledge of the outside world and what are the crises happening within my field and in other crises around the world too. And it will also help to improve my communication skills in writing and reading. Body language. So the fifth part is on body language. So body language is basically just nonverbal communication. Eye contact, hand gestures, everything that makes my presentation convincing and saying that I am confident in what I'm saying. The sixth point is the sixth way to improve my communication skill is concise and clear language. Next is asking for feedback and practicing speaking. So we all know we need to practice. Practice makes perfect. So practice, practice, and practice speaking. Speaking in front of the mirror, speaking, recording myself speaking, or anything, any way that helps me to improve my any ways to help me practice my speaking and thus improve my communication skills. So that is the third way. The final part is how to communicate effectively in healthcare. As a doctor, I need to know how to have communication skills. Why? In the importance part, patient satisfaction, help with patient satisfaction, reduce stress, accurate information exchange, the enhanced team bonds, etc. So how do I communicate effectively in healthcare so that there will be a better patient outcomes? Well, firstly, I need to prioritize active listening. Instead of talking over the patient's sentences, I need to be a listener. I need to be a good listener. I need to listen to my patient's point of view, see what they're going through, put myself in their shoes, And yes, that is prioritizing active listening. They will be more comfortable sharing with me as a healthcare professional. Clear and concise language. So I've talked about this before. Clear and concise language will lead to reduced medical errors and also reduce misinformation and misunderstanding. Next is nonverbal communication. So nonverbal communication, hand gestures, my eye contact. I need to keep my eye contact with the patient and don't look anywhere else in the room, because that will make me look like an unprofessional healthcare worker. Next is establishing a comfortable environment. So I need to make sure that the temperature in the room is good, and there are some comfortable factors like giving the patients access to the bathroom near there, or giving them some pillows or some comfort, something comfortable, so that they will be able to feel comfortable when I'm asking them questions. Showing respect and empathy. So these two are related. Showing respect and empathy are like the same page. Empathy is showing kindness to someone and also showing respect to them. I need to show respect and empathy to my patients so that they will feel loved and they feel understood. Therefore, they are more likely to share information with me so that I can give them a better diagnosis and lead to better treatment plans as well. Communicating with other doctors. So I've talked about this on the examples part about the treatment plans of the patients, communicating with other doctors effectively so that we can both develop a good treatment plan for our patients. The eighth way is to have an appropriate tone. So having an appropriate tone is like when we're in a solemn, when we're delivering the bad news to the patient, we need to have an empathetic, a compassionate tone. Or when we're delivering good news, like they're expecting a baby or they're free from this disease, we will have a glad, relieved tone and give them so they will have they will be able to feel that the seriousness of that situation, and they will understand what they're going through, both the patient and their family. So to conclude this video, I have a quote. To effectively communicate, we must realize that we are all different in the way that we perceive the world and use this understanding as a guide to our communication with others. This quote is from Tony Robbins. So what this quote is saying is that we humans are different from each other. We have our own beliefs, our cultural differences, and we need to take advantage of the different ways that we perceive the world into our career so that we can effectively communicate with others. So that's exactly what the quote is inferring. So those are all my ideas for my main video this week. I hope that you learned something new from this video or just review some of the things that you have learned. If you have any other opinions on how I could improve my video or any other questions, then I would be glad to answer them. Thank you again for listening to my video, and I hope to see you in the next meeting or the next video. Goodbye, see you later.